Hello, my name's Joel Dunning. Welcome to this edition of the CTSNet Beat podcast. This is the podcast that gives you all the news so that you keep up to date with everything in cardiothoracic surgery. We've got a packed edition today. We've got interesting news about Tavi 5-year survivals. We've got some gender disparities. We've got strikes in the United Kingdom. And we've got an amazing series put together by Gridal all about the tricuspid valve. So stay tuned as we get moving into the CTSNet Beat podcast. Welcome to this week's edition of the CTSNet Beat podcast. My name's Joel Dunning, and the point of this podcast is to keep you up to date with all the news in cardiothoracic surgery. I don't know about you, but 20 years ago I used to get journals through the post. I'd get piles of journals in the corner. I'd have a bit of a flick through and see the odd article that interested me. I just don't have time for that anymore. Equally, everything's gone online. So the whole point of this podcast is so that we're going to select all the interesting articles and news for you and present them here in an easy podcast. Also, we need your help. So if you see a really interesting article, maybe you've written an interesting article, please do send it to me, Joel Dunning at CTSNet. So let's get started with this week's edition. So the first thing we've profiled is an interesting news story in the United Kingdom. Junior doctors in England to strike for 4 days in April. So we've selected an article from The Guardian in the United Kingdom, and we thought this might be interesting for you guys over across the pond in America because junior doctors are striking in the United Kingdom. They are having a whole week of not working. As you know, the National Health Service in the United Kingdom covers the whole of the UK. We all work for one employer, and every single junior doctor from the first year houseman to a week off being a consultant are walking out. Now this has huge implications for our whole service nationally. Especially in the medical high volume specialties, consultants are having to get down on the floor, get to the wards and look after our high numbers of patients in hospitals. So outpatients are being cancelled, clinics are being cancelled, and in quite a lot of cases, operations are being cancelled for the whole week. This comes at a really bad time because we've got a big backlog from COVID and is highly controversial. But the British Medical Association says that pay has gone down in real terms by 26% in 12 years, and they're seeking redress. They want a 35% pay rise for all junior doctors in the UK. Now, obviously, that's a starting point. They won't get that, but maybe they will get a decent pay rise because things have been slipping. Tell me what you think. What's it like in your country? We certainly know in America that in real terms pay has gone down very significantly. What's it like for junior doctors? And do you support strike action? Can you even strike? Is it even possible in your country? So it's a really interesting article, I thought. So check it out on our website. The second piece of news that we have selected for you is a really interesting article by Stephen Yakubov. He's an interventional cardiologist at Midwest Cardiology Research Foundation in Ohio. And the title of it is Bioprosthetic valve dysfunction is less common in Tavi than surgery at 5 years. So they have published this article, which was published in JAMA just this week. And it basically says that over 5 years, the Tavi valves had a failure rate of 7.8%, but the bioprosthetic surgical valves had a failure rate of 14%. They also found that if you got severe patient prosthesis mismatch in your surgical group, the differences were even bigger. They don't tend to get much mismatch in the TAVI groups, but they do in the surgical group. So if you've got a severely mismatched group, then the difference is a 20% failure rate in the surgical group and only 8.6% in the TAVI group. Whereas that goes down to only 12% if you don't get prosthesis mismatch. So it was an interesting article. For the first first time, it's trying to suggest that Tavi is actually better than a bioprosthetic valve. Now, if we look a bit more carefully into this, they try and persuade us that this is all data from RCTs. They put together a series of RCTs, and these are all core valves. So CoreValve pivotal study, which was 600 patients, Tavi, which was 1,500 patients, but then they've added 2,000 patients from the non-randomized group of their continued access registry. I want to see a little bit more about these groups. Maybe in the registry data, the patients are going to be older and frailer, and we certainly know slightly younger patients do wear out their valves more easily. And I think the numbers from the randomized trials might be swamped by this access registry. But it is really interesting. So this is certainly the first article I've seen that's actually trying to suggest that it's better to have a Tavi than a surgical valve. But what do you think? Should we stick to randomized trials on this? And hopefully we are getting longer data for these patients, so we will see more articles like this going forwards. But well done to those to that group. Well done for presenting it, and check it out on our website. This article by Stephen Yakubov. Then the third article we have selected for you was what we thought was quite interesting. It says that it's a Canadian newspaper, the Globe and Mail, from Canada, saying in the operating room and the hospital boardroom, women surgeons are not treated equally. 2022, and this article actually says that the main author has been reading articles for 30 years. Dr. Fahima Dosa, she read 30 years ago that people said there was disparities, and yet there's no difference, especially in cardiothoracic surgery. So it does document in Canada that women still only make up 33% of the surgical population. I was very interested to read actually that in medical schools in Canada, that now there are more women than men at medical school, 58%. But this is not being reflected in the higher echelons. And I think really in cardiothoracic surgery, we are one of the worst performing at male versus female parity. And in Canada, there's only 9% of cardiac surgeons are female. And that really is a shame. Dr. Dosa goes on to say that she has personal experience of female trainees interested in surgery having been asked, do you want a family? How are you going to balance that? Things that really stick in their mind, make them have doubt, and that really just isn't right. She does actually highlight some other shocking cases, and in Alberta, our very own Teresa Kieser, a wonderful surgeon, lots of interesting in total arterial grafting. She actually had to file a human rights complaint, having endured 3 decades of discrimination at Calgary. And Dr. Irene Kybulski actually won a gender discrimination act against the Hamilton Hospital after losing her position as head of cardiac surgery, where she successfully argued that discrimination led to her being ousted. So it is sad that we still have this in our specialty, but the really positive thing in our specialty is that we have a fabulous group, the Women in Thoracic Surgery group from the STS. We really have to support that group. And we have absolute superstars in our specialty that I hope the next generation of medical students, of which women outnumber men, will be looking to amazing people like Shanda Blackman, amazing people like the editor-in-chief of the Annals, Joe Chikwi, Blair Marshall, who's doing the first single port robotic thymectomies up in Brigham and Women's, and Mara Antonoff. We have these amazing leaders who are females in our specialty, and I hope that in the next years, next decade or 2 decades, we will look back as a very historical phenomenon that we only have 10% of women in cardiothoracic surgery. So that's some of our journal and news scan items. Let's just go over to CTSNet to hear a bit more about things you can find on our website.
Are you on the lookout for a new job in cardiothoracic surgery? Hundreds of open positions are waiting for you at CTSNet's Career Center. Through ctsnet.org, you can browse jobs and sign up for custom job alerts direct to your inbox. For an even more enhanced experience, create a free account and upload your resume so employers and recruiters can find you. Happy job hunting! Now, back to the beat.
Welcome back. We've picked 3 things of CTSNet content that you absolutely have to check out, and the absolute stellar best piece of content we've got on CTSNet this week is the Guest Editors series by the fabulous Gridal from the Riks Hospital in Norway. We were just talking about women in cardiac surgery, and Gry is an absolute stellar superstar. She's a cardiac surgeon, she's a transplant surgeon, she's absolutely brilliant. And also, Norway is just the most fabulous place for parity. I actually went there 3 years ago to visit their brilliant national conference, and I met a trainee cardiac surgeon, and she took 3 months off for maternity leave, and then her husband was taking 3 months off for paternity leave. They had complete parity. So I think we do need to look to Europe and especially the Scandinavian countries for gender parity. But anyway, Gridal has done an amazing job of putting together a load of Tavi amazing content for us. So in this content, she has got some phenomenal videos, and we put together 7 for you. So first of all, Gilbert Tang takes you through Tavi, its evolution. It's incredible to think that it's been 21 years since the very first Tavi. So he talks you all the way through the evolution. The next article that she chose was a brilliant video demonstration of a transcaval transcatheter aortic valve replacements. Now, I will put my hand up and be honest that I didn't know this was as possible as this video demonstrates, but putting the Tavi valve through the inferior vena cava, through the femoral vein, crossing transeptally, and then going antegrade up into the valve makes a lot of sense. Also probably safer. You know, we do have a lot of people with bad femoral arterial disease, so this really makes a lot of sense. I had the question of what do you do about that giant hole in the septum, but this video describes beautifully how you basically just occlude it with a little Amplatzer device as you come back out. So really interesting video. The third one is on transcatheter mitral valve replacement, all about valve in valves, valve in ring, valve in MAC as well. So obviously the nadir, the big weakness of Tavi on the mitral is how do you hold that valve in. But if you've got a ring, if you've got severe calcification, that makes this a lot easier. And Kendra Grubb takes us through all these issues. The next valve in Gry's series is the how to do it, preventing left ventricular outflow obstruction when you're doing a valve-in-valve procedure on the mitral. And this is a brilliant video by Thomas Modine. The next one's transeptal mitral annuloplasty. Makes a lot of sense, doesn't it, doing annuloplasties in the mitral position, because we do them in all the surgical procedures, so that makes a lot of sense. And then the next video, Gridal is an absolute expert in the Tendyne transapical mitral valve, and Thomas Modine does a lovely video on that. And I don't really think there's a big future on the Tendyne valve. It makes a lot of sense. Transapical access, a lot of people have got a lot of experience with it, and the great thing is you can put a little button at the apex to stop it displacing, so it's held really nicely in an annulus, even if it doesn't have any calcification. And then the final video that we are going to profile is my favourite out of the whole series, actually. This video is by Maurizio Terramasso and Eduardo Zancanaro. They're from the San Raffaele Hospital in Italy, and the title of their fabulous video that you have to check out right now is The Current Status of Tricuspid Valve Interventions. This is a brilliant presentation about what they call the forgotten valve. And I hope it isn't forgotten too much these days, but you know, when I was training, you know, a lot of times we'd fix the mitral and we'd say, oh, let's just leave that tricuspid. It's only moderate, it's only a bit dilated. But this video tells us all about how that's a massive mistake. They go through tricuspid valve surgical interventions. They talk about when to intervene surgically. when to do concomitant tricuspid as well as mitral, when to do isolated valve surgery. And then for me, they do a really nice job in describing the 5 different progression stages of tricuspid regurgitation. I didn't really appreciate those stages, and they do a lovely picture and a video about that. And then the thing that's really stellar about this presentation is that they then go through the absolute state-of-the-art with transcatheter valve intervention on the tricuspid. And I personally didn't realize how much there is available out there in actual CE marked clinical use. So what do they highlight? Well, they highlight the TriClip by Abbott. This is an edge-to-edge repair technique that allows tricuspid valve repair by bringing the leaflets together, which was really interesting, and they show some pictures and videos of that. They then show us the Edwards Life Sciences Pascal device, which again is another edge-to-edge repair technique, which is great, which can actually be used for the tricuspid and for the mitral, which is really nice. And they show a multi-center study that has been done in Pascal, showing really good 77% reduction in any tricuspid regurg, which is really nice. And then they tell us about this very novel device called the Cardioband by Edwards, and that's an annuloplasty device rather than a edge-to-edge repair device, and they show some pictures of that, which is really interesting. They then also show us about some replacement techniques. There is a valve called Tricento, and there's a valve called Tric valve, which is really easily placed. It goes through the inferior vena cava, so you don't have all those problems of calcified arteries. Looks quite easy to put in, and really very interesting. So watch this space and do watch that video. Fabulous job, everybody, for putting that together. And hopefully no longer will that tricuspid valve be the forgotten valve. I think it was forgotten because us as surgeons sometimes don't follow up patients, and it's the cardiologists that keep coming back to us to saying, God, 3 years later, there's severe regurg in the tricuspid. So I do encourage people to follow up their patients having mitral and tricuspids, whether you leave or preserve the tricuspid, and just have a look at your own data at 5 years to see how that tricuspid valve is going on. So every week we like to profile some upcoming events in cardiothoracic surgery, and there's no bigger event coming up than the AATS 103rd annual meeting. This is going to be held in Los Angeles, in the Los Angeles beautiful, huge convention center. It's on May the 6th to the 9th, and Shav Kashavji is the president. He's going to focus this year on innovation. He's done a lovely video introducing it on the AATS website, so do, if you haven't already, look to put in some leave, go visit it and register now, because that's going to be an amazing event. And we'll have a CTSNet presence there, so do come up and say hi to us, and we're going to try and post a few interesting things when that comes along. Other things going on around the world, EACTS has a really interesting case corner, and this month's case corner is in transcatheter aortic valve implantation. Now you can submit your cases to the case corners at EACTS, so do look out for them. They do this very regularly, and then this particular case corner is going to be posted as a virtual online meeting, so you can watch it all around the world. It's going to be on April the 20th, and it's going to be a 1-hour session all about complex TAVIs. It's going to look at case characteristics, it's going to look at interesting cases. You can chat, you can be interactive, and we're going to see some really interesting case scenarios. So check that out on the EACTS website. It's not to miss if you're involved in TAVI. Some other really interesting things coming up. The STS is doing a workshop on robotic thoracic surgery. This is April 20th to the 21st. This is hosted by the fabulous Abbas, Jason Long, David Rice, Indipal Sarkaria, and Lana Schumacher. This should be really interesting and is a not to miss. You can find out where this, how to log into this on the STS website. And talk about robotics, don't forget the Mayo Robotic Surgery course. It's going to be on the 16th of April. Go and check out the Mayo website. I'm going to be doing a little video on uniportal robotics, but it looks like a really good session. There's going to be not just thoracics as well, and there's going to be a lot of AI in it and a lot of interesting things. So lots happening in robotic thoracic surgery this month. So as we come to the end of this week's podcast, we've just got two more little things. We always find out, where is Diego Gonzalez Rivas, the world's most fabulous thoracic surgeon traveling the world, and also helping his foundation to help underprivileged people access thoracic surgery. Last week he was in Shanghai Pulmonary Hospital doing some amazing cases. Where is he this week? Well, this week he's in Bucharest with Mugarel, his fantastic right-hand man, where they created uniportal robotic thoracic surgery. He's there doing uniportal robotics in Bucharest in their fabulous centre. So we'll hear lots more from him and check out next week to see where he is in the world. And finally, we always end up with an honourable mention. And this profiles somebody absolutely fabulous in our community and the great work they're doing. And I could not do better than profiling and giving the honourable mention to the amazing Duke Cameron. Duke Cameron is just one of the most amazing cardiac surgeons in our specialty today. He's from the Mass General Hospital, but he's dedicated his whole life to an amazing series of operations. He does a huge amount with Marfans. He's got some fabulous videos on CTSNet on the Ross procedure, on aortic root enlargement, on Bentals. He's got podcasts on valve sparing root replacements. We've done Giants interviews with him, but the biggest piece of work he's done is being an unending stalwart of CTSNet. He's our president of CTSNet. I just wanted to say a huge thank you for Duke and all his amazing work that he's been doing with CTSNet. He's certainly far from retiring. He'll be doing masses more, I'm sure. And so thank you so much to Duke Cameron. Check out his profile on CTSNet. Go and look at some of his valve videos. If you want to learn anything about aortic surgery, he's certainly the man. So thank you so much for Duke and all your amazing work that you've done for our cardiothoracic community. So that's it from me, Joel Dunning, and everyone at the CTS Beat podcast. I hope you've enjoyed it. We're brand new, so we want to get better. We'd like to hear your feedback. We'd like to get you involved. Please do post some interesting content or any videos that you might want us to profile, and we'll give you a shout out in the next edition of the CTSNet Beat podcast.